Good afternoon to you. We just had a meeting with roughly 20 department directors and other officials here at City Hall. Myself, I'm Quentin Lucas, the mayor, our acting city manager, Ernest Rouse, and a number of others representing a broad range of departments, which includes our Department of Public Health, Aviation, Public Works, the Police Department, Fire Department, and so many others, to talk about the coronavirus, to talk about our response and our preparation. I'm flanked by two of our top doctors here in Kansas City. They'll speak in just a few minutes about some of our own preparation for it, but I wanted to note a few things. First of all, I'll start with if there are any Kansas Cityans who are interested in updates as to our response, some of the information that we've been able to gather so far, you can go either to kcmo.gov. We have updates on the city's website, or you can text COVID, C-O-V-I-D, to the following number, 888-777. Again, you can text COVID, C-O-V-I-D, to 888-777. There is much right now that is unknown about the coronavirus, but there's much that we do know right now in Kansas City. One of those things that we do know is that we are prepared, and we are preparing every day, working across departments in our city, but also making sure we're working with state and federal agencies in connection with this. Each day, our public health officials and so many others are in contact with our peers, both in public health and public safety and beyond, to make sure that Kansas City, its residents, and those in our surrounding communities will be ready in connection with the virus itself. We will note a few things. At this point, we are looking to make sure that we are prepared, but a few things we don't know is the extent to which we may be confronted with different challenges. What I want to make sure I note to all of you is that in our communications with our local hospitals, with so many of our public health providers, with our emergency medical services and others, we have already taken steps to make sure that we have enough folks that will be prepared to address the issues, to make sure that we're going through good practices such as cleaning our facilities, making sure that we're directing all of our employees to wash their hands, to do some of those old basics, encouraging folks to stay home if they feel sick, right? A lot of those, frankly, kind of rudimentary things that can help us stop the spread of virus. And so we're working on all of that as well. What I want to say to anyone who is worried or is concerned, Kansas City has prepared for these sorts of things before. We expect to be ready for this again. And we look forward to making sure that as we're confronted with any challenges, we'll be leaders in this region, throughout our state, throughout the Midwest, in making sure we can address this issue. Our first speaker I'll have today is no stranger to any of you. Dr. Rex Archer has been our Director of Public Health since 1998, and he's greatly experienced both in this area and beyond. So Dr. Archer, if you can say a few words.
Thank you, Mayor. This is not our first time to the dance. As mentioned, we've been doing this for over 21 years. Our health department or myself or both have served on all types of national committees to develop preparedness. Our city auditor, even back in 2007, did an audit on our pan-flu preparedness as a city. So this has been a continued process. We keep getting better and better every year. Think about pandemics as categories just like hurricanes. It can be category 1 through category 5. And hurricanes sometimes change before they hit the coast. So we will adjust, we will change, we will not overreact, we will not underreact. And people need to understand we do not have any confirmed cases in Kansas City right now, but it will be inevitable that we will. And so we're working with all of our other cities across the U.S. Those health directors and I actually met last week in Washington, D.C., spent half a day just looking at how they've been managing this outbreak and how we'll manage this outbreak. So we're in good hands, but you're going to be a critical part of this. As the media, we have to continue to inform folks on what they can do to better protect themselves, their families, friends, their neighbors. Will all be working together. As we've said, namaste or the elbow bump. I'm asking for people a moratorium of handshaking. Let's wash our hands, wash our hands. Thank you, Mayor.
Thank you. Thank you, Dr. Archer. I also, thank you. I now have a chance to introduce Dr. Erica Carney, our Director of EMS in Kansas City, and she's also an emergency medical physician at Truman Medical Center. So Dr. Erica Carney.
Thank you, Mayor, and thank you, Dr. Archer. I want to piggyback on what both the mayor and what Dr. Archer have already said. We have been having meetings for weeks now about this. So in the region, I am also the Region A Medical Director. We are meeting at least weekly. And then here in our own region in Kansas City, my office has been in close contact with Dr. Archer's office as well. So I appreciate that communication. I would invite the healthcare system currently, if you are already having struggles with influenza, RSV, high volume, use this as an opportunity to strengthen your already existing infrastructure. Be open to having tabletop discussions about what if this happens, what if that happens. But use this as a time for preparation, because that is exactly what we are doing on our side as well. I agree. We are prepared. We are in constant communication, and we will handle this whenever it comes our way. Yep.
Thank you, Dr. Carney, and thank you, Dr. Archer. We have time for a few questions, and we'd be happy to take them. Melinda?
I keep reading that people who have a bunch of the symptoms can't get tested. So do we know how many kits we have or what the delay would be? If you have symptoms and you fear you might have this, I was just reading on Twitter, some lady, it took her forever to get tested.
So we've had a challenge in the U.S. With the lab testing process and some contamination, and so that has been corrected to my knowledge, and more labs will be coming online, including some commercial labs that will also be available beyond the state labs and centers of disease control. In a sense, because there's no specific treatment for this different than influenza, you could actually make the argument that for the individual, other than curiosity of knowing what you have, it doesn't really change the outcome. And once we start seeing lots of cases in Kansas City, I want to remind you that 4 out of 5 folks will be able to heal easily at home. They shouldn't even have to call their doctor because they'll heal without that. We don't have to overburden the system from that. The challenge is for those that are getting iller, and then they'll be coming in regardless of whether they think they have corona or not, and we'll be giving the same types of treatment to an individual whether they have influenza or coronavirus. There's no specific treatment for this right now. It helps us from a public health standpoint in the early stages to do the contact tracing to try to figure out where the exposure is occurring. So yes, we want the lab capacity to improve, but it's not a main game breaker right now for us.
We have kits here for us now. We do.
We'll let you follow.
Except if you were contagious, you would want to know that. Not just for your own treatment, but for the safety of others.
Dr. Carney?
I would also add on to what Dr. Archer is saying is that the test is not immediate either. So if there is a high concern for this exposure, we have to go forward with the proper measures without an answer, without a test anyways, because it takes time for us to get that answer back.
Next question will come around this way. Yes, ma'am.
You talked a little bit about the fact that you guys are monitoring some folks right now. So can you talk about what that picture looks like, and if you need to, when you figure out if you need to pull a trigger on somebody because they're looking like they might need a next level of care?
So across the metro area, across the U.S., we have a lot of people that we are monitoring. And what we mean by monitoring is we actually give them an app that they can put on their phone, and they can report their temperatures twice a day to us, as well as symptoms. If those start to change, then their category starts to change, and they move to what we would call a person under investigation. At that point, then we will go out and do the lab testing to determine whether or not they might have this disease. The problem, as mentioned, is that it may still take several days before we get those results back, so we have to presume that that might be what they've got, and we're already keeping them basically under a kind of a quarantine situation. So I don't know if that's
responsive. Anyone over here? All right. Allie?
Can you speak more specifically to what kind of steps you're taking aside from having meetings and staying in touch with federal authorities?
I'll start with that because in some ways the answer is at this point, no. We are making sure that we're as prepared as possible. So necessarily part of that is actually talking to our state and federal partners somewhat regularly. It's also making sure that we're collaborating across departments. So from the local government side of things, it is making sure that we have contingency plans with different departments, making sure that we can address staffing, particularly the EMS services side, the fire department, our medical services, understanding that there may be increased calls to 911 and 311, and seeing what types of responses we'll need. So at this point, that is where we are. Of course, as Dr. Archer notes, there are different categories, not unlike a hurricane classification, as the doctor has taught me, that will require different responses. We are not there yet. We're making sure that in the event that we are there, that we're ready and that we have the infrastructure available to help address that. And another important part that we can't emphasize enough is also our communication with our area hospitals, right, and health institutions. I mean, that is an important part for us. But there's also just this basic, and there's a reason that I'm saying this, because they told me this about 20 times, which is that if you are someone who is feeling ill, if you feel symptomatic, first of all, you can often stay home. There is not a reason to go to the emergency room feeling sick with this sort of concern. A lot of it does relate to making sure that you're staying home, you're staying away from work, and some of those same basics that we've addressed with the influenza for years are what we're seeing in this situation too. Go ahead.
The aviation director and the director of the KCATA were here. Can you talk about what role that they will be playing in preparing and what role transportation and travel has in this?
I'll try to paraphrase, and in the event that I don't say enough, or we'll see if we have to add in Pat Klein, who is here right now. I think both the director of KCATA and our aviation director were basically noting the same thing that we've said a few different times, which is how do we make sure we're prepared in the event that there is a passenger who is presenting with different issues relating to the virus, and they are landing at KCI. It's making sure that we have EMS services that are quickly available. They have taken, I think, key and important steps to make sure that they can respond rapidly to that at the aviation department in much the same way that they're often prepared for any other medical emergency with someone that may be landing at KCI. So that's much of the preparation we talked about there. We also are making sure we always have a clean and outstanding airport, making sure that we're doing things like providing more soap. More people are washing their hands right now, which is a great thing regardless. Making sure that we're stocked up regularly, making sure that even so much as in how we clean, we're doing it with a look to how we're making sure that we're limiting the potential spread of illnesses. And making sure that we're frankly doing it somewhat more regularly, coming up with a heightened schedule for how we address those issues. And largely with KCATA, it's that same story just with buses. And ensuring that not only, and with KCATA, that interest is even more pronounced because they work, of course, not just in Kansas City, Missouri, but throughout a number of different jurisdictions. Robbie Mackinnon and his team have been in contact with all of them, and so therefore we feel like that we're confident that all of our different transportation-related authorities are prepared. Same story with Kansas City Streetcar Authority as well. Yes?
Do we have test kits here?
So we have the ability to draw the samples and send them in. We aren't doing community surveillance at this point.
Along those lines, do we have any plans to alter the basketball tournament coming up? And we'll also have voting coming up. Are we going to take any precautions, people wearing gloves or masks or anything like that with these group outings?
No, unless for some reason the circumstances change. Yes, ma'am.
Is there screening happening now at the airport, or are there plans to do screening for incoming travelers?
There's no screening taking place at the airport currently. We'll continue to monitor, and if the need rises, then we will.
So the answer is no for everyone who needs to hear.
I'll take two more questions.
Sorry, let me keep going away this way. Yes, sir.
Will local providers at some point be getting the materials to do the testing, and if so, yeah?
So we've sent out 6 of what we call our health alert messages to all the providers in the area that are on that serve. And we update them on the various criteria. Yes, there are several national labs that are in the process of getting their quality control in place so that they'll be able to start offering the testing, so the providers will be able to get that. I can't give you a specific date at this point of when that's going to be available, but I think it will be within not too many weeks.
And you have expressed some frustration about the resources provided from the federal government to local health departments. Have you seen anything to indicate that that's changing or that will change?
You know, any time that you have a new challenge, you may at first think, well, boy, I need more resources. But the reality is that this right now is not that different than influenza. And, you know, so we're using those models right now. We'll see, remember, we have no confirmed cases yet in Kansas City, so the chances for various other federal resources to get here are still kind of in the pipeline, so we'll see how that works.
Dr. Carter, did you add?
Yes, so as a healthcare provider here in the region, if we keep this on our radar and we have a high suspicion, the most important thing for us is direct communication with the health department and Dr. Archer's team in regards to testing and who we test in. So for us, if we do encounter a patient that we are suspicious about, we already are screening from 911 standpoint for any type of shortness of breath, fever type of questions. Same on the hospital side, most hospitals here in town are doing pre-screening questions. And then again, we take appropriate measures. If there's a high concern, we are in direct contact with the health department.
We have time for 2 more questions. Yes, sir.
Dr. Archer, you said it's inevitable that Kansas City will see some cases. As you all prepare for possible cases to get here, what are some of your biggest concerns as you prepare and once those cases actually come to fruition here?
Well, unfortunately, we have a lot of residents that don't have sick leave. And that's going to be a challenge if they need to take off work and they are not paid. So I do have some concerns. I'm basically calling for all of us to be thinking about those that are challenged on these issues. If you have a food pantry and you have sources of protein in case you need to stay at home, but does your neighbor? Can you be stocking up some of these things so that you can help others in need? Kansas City is at its best when we're not just thinking about ourselves, but also thinking about how we help others.
And then one last question, anyone?
For
Yes,
vulnerable
Bianca?
populations, nursing homes, older residents, special concerns and actions there.
That's a very good question. So there are certain patient populations who are affected differently with this virus, just like influenza. And so we look at populations that, per the reports that have been out there, over 60 or 70 years old, plus some other comorbidities. If you have a loved one who is in a nursing home, stuff like that. And so if we have patients who are younger than 60 and healthy, I have a young child at home, they're actually recovering quite well from this. The children are actually doing really well with this and they're recovering, unlike the flu with kids. And so if you are considered elderly, over 65, between 60 and 70 or older, or you have comorbid conditions, we do know that this virus, just like any other virus, can affect you differently than a young, healthy 20-year-old.
I expect updates from CDC on procedures for those types of facilities because we have the outbreak in the state of Washington right now and those deaths, so that population is more challenged. It probably, well, nobody should be going to a nursing home to visit somebody who is actually, that they themselves are ill and might be taking an infection into that nursing home. So those are things that are just standard procedures.
All right, as we address this issue, we'll continue to update you. It will usually be this group with Drs. Carney and Archer and myself. As we noted at the top, you can get updates at kcmo.gov or by texting to our number, which I believe was 888-777. Text COVID to 888-777. Thank you all, and we hope that we're all able to share information as time goes on. We do ask you to be responsible as we share it, and we'll try to get you as much as we can as well. Thank you.
Thank you.
Thank you.